Hi everybody, and welcome to the Tuesday edition of Video Clips. And just a couple of things, it is almost time for summer semester. So if you're going to be taking classes through the Institute, either as part of the Nutrition Educator program, or if you're planning to take our Diet and Lifestyle Intervention program, it is now time to register. And so if you want to learn from the best of the best, including moi, Dr. Goldhammer, Dr. McDougall, and all the other docs in the plant-based world about everything from how to prevent, stop, and reverse disease to vaccinations and mental health issues and all that good stuff, let us know and we'll show you how you can get signed up. So I'm continuing to cover the many issues in this book, Catastrophic Care. I always assume you guys aren't going to read it. Like, I hope you get really interested enough to read it, but if you don't read it, you get all the basic information. You know what I'm talking about. And my whole review will be posted at the end of the series in the Health Briefs online library, just so you know. So picking up where we left off, you know, Goldhill calls the insurance companies and Medicare and Medicaid surrogates. And he discusses the fallacy that the surrogates can control costs. They're not. And even the fallacy that the actual cost of services are being reported to us accurately. The idea that costs have already been brought under control, we've actually been told that the surrogates have already done a great job for us, but it's even worse than we imagine as you dig a little bit deeper into the issues. So I'm going to talk about hospitals first, and this is some stuff I didn't know. Hospitals operate on a three-tiered system for reimbursement. Patients with private insurance get the best treatment, and these people are, at the same time, the most likely to question the need for additional treatment and services. In other words, it's a little harder to sell extra stuff to these people. Medicare patients can be profitable if enough additional treatments and services can be sold to them. In other words, by paying a lower fee for services, the system, in this case the government, incentivizes the hospitals to sell them more services. And you might remember a couple weeks ago we were talking about the chemotherapy concession. When the amount of reimbursement went down, the number of treatments just went up to compensate. Now, Medicaid patients fare the worst because the reimbursement rates are so low. And the way that hospitals make money on Medicare patients is strictly through volume, providing less quality services, but also by selling these patients the most additional treatment and services. Only providers willing to engage in high-volume medicine or who have trouble attracting patients from other sectors thrive in the Medicaid reimbursement scheme. Price constraints are supposed to be part of the Affordable Care Act. That's one of the things it's supposed to address. And on the surface, this appears to be a great idea, but is it really a good idea? Insurance companies' marketing policies to large companies have to pay out 85% in claims. Their profit margin is 15%. For smaller employers, 80% is the payout, 20% is the profit. Based on past experience, it's quite possible that insurance companies will compensate by inflating the number and costs of services offered to patients. In other words, if your gross margin can't be improved by operating more efficiently or economically, profits can be maximizing by just selling more care at higher prices. Again, like the chemo concession that we talked about earlier. Goldhill really doesn't have much faith that the Affordable Care Act will achieve its goals. Will more people get coverage? Well, this is no longer clear since the Supreme Court allowed states to opt out of Medicaid expansion. Not much else has changed. Insurance is still primarily offered through employers, and the surrogates are still in charge of regulating prices. The Affordable Care Act did nothing to address the cost of care, which have tripled since Clinton's attempt at health care reform many, many years ago. Nothing to address the dangers of our system, which has killed more people. Wait till you hear this statistic. Our healthcare system has killed more people since 1999 than have died in all of America's wars combined. It simply offers more insurance and more top-down control, which is proven to be ineffective. The Affordable Care Act equates insurance to access and access to quality. You guys have heard me talk about this before. Our friend Tim Russert, who worked at NBC, who had great insurance and access to care, he still died at 58 of a heart attack. It assumes that, the Affordable Care Act assumes that we can make insurance affordable when health care isn't affordable. And Goldhill asserts that the net effect may actually be a reduction in the number of people who have health insurance. The Affordable Care Act touts the idea that now everyone will have access to insurance, but not having insurance is not the same thing as not having health care. And Goldhill's premise is that excess insurance is the cause of healthcare dysfunction. Estimates of the number of people who are uninsured are very unreliable. And this is a point that was debated when the Affordable Care Act was being debated in Congress. 20% of the population lacks insurance at any given point in time, but 40% of these people have no insurance for less than a year. And people age 18 to 30 represent a third of this group. These are the people who are most likely to consider insurance an unnecessary expense because they think they're invincible and nothing's going to happen to them. And in fact, there is some data that suggests that uninsured people may actually be more healthy than the insured population. And one of the reasons they don't have insurance is they know that. In fact, 90% of uninsured people rate their state of health as excellent. So it's estimated that about a third of the uninsured population is really comprised of people with low incomes and very high risks of health issues. Well, how did the uninsured fare? Since we're talking about uninsured people, they received $56 billion in uncompensated care, meaning they didn't pay for it, most of which was in the form of free hospital services. But these costs are at least partially compensated because hospitals receive lump sum payments from both state and federal sources based on the populations they serve, which incentivizes them to inflate services delivered and the prices for those services too. And I'm hoping you're starting to understand how perverse this system is, and that as long as it stays this way, any attempt to bring it under control is absolutely going to fail. So we'll pick this up on Thursday. I'm going to continue to cover this very excellent book, Catastrophic Care. You probably think, oh my gosh, we're on chapter 80 already, but this really is important stuff. If we're going to reform healthcare in this country, we really are going to have to look at some of these issues and maybe just start all over again with a new system. So pass this on to anybody who you think ought to hear about it, and I will talk to you again on Thursday.